So let's talk about the 5 basic principles of Pilates here. The first one we're going to talk about is breathing. So if we bring the hands onto the belly, interlace the hands, a little bit of resistance into the hands so you can feel the movement up and down. So as you breathe in, the hands will lift. As you breathe out, the hands will release. Sometimes putting something like a small ball or a cushion can help you breathe into something if you're finding that tricky to do. So as you breathe in, the ribs are expanding through the front, the sides and the back, particularly through the sides and the back. So lateral breathing, posterior breathing through the back of the rib cage where the insertions are into the rib cage, into the thoracic spine is a little bit more tricky. There's a lot more ligamentous structures there. So you're trying to aim for that stretch of your thoracic spine as you breathe in and the ribs stretch through the back as well. Nicely done. So as you breathe in, the mechanics here, the breath goes in, it goes into the lower lobes of the lungs. You have really good at gas exchange down in the lower lobes of the lungs in the alveoli, about 70% gas exchange there. It means that the accessory muscles around the top of the chest in the thoracic area can have a chance to switch off. So this is an area where when people are under a lot of stress and tension or have just got into bad breathing habits, they're overusing the accessory muscles which are lifting the top few ribs, and it creates neck tension. So we're trying to relax the neck, the upper area, and really get the lower lobes of the lungs working for that gas exchange. So the reason why gas exchange works really well down there is that the blood vessels around the alveoli allow that exchange of carbon dioxide and oxygen. So as you breathe in and the alveoli, the lower lobes of the lungs expand, the diaphragm moves down the body, the abdominals lift out of the way to allow the diaphragm down. As you breathe out, the air moves out of the lungs, the abdominals connect, the diaphragm moves up. So it's a sort of an action where the diaphragm and the abdominals are working together. The pelvic floor also works with the diaphragm, so as you breathe in, the diaphragm moves down, the pelvic floor muscles just release. As you breathe out, the diaphragm comes up, the pelvic floor muscles connect. So it's a dynamic situation where we're not bracing and holding, we're allowing the pelvic floor and the diaphragm to work together. So as you breathe out, the ribs will come through and push together, will come together, and the diaphragm as it comes up forms a seal with that rib cage. Pelvic floor is moving as well to form a seal at the bottom of this imaginary cylinder around your middle. So the seal at the top, the seal at the bottom, and then the abdominals, the transverse abdominis, the deep core muscles helping to stabilize, create a system where the lower back is now protected. So when you breathe out, try not to flex, try and keep your neutral spine and feel this cylinder forming on your out breath to give you more stability. So the messages to your lower back when you breathe are that the core is switching on, you have stability, and that spasm that people get in their lower backs can just turn off and relax a little.